Hi guys, Candace Jones here today. I'm sitting down at Coastal Wellness, one of my favorite places, and I'm sitting down with one of the owners, Brooke Knight, and she is an awesome massage therapist. She's very skilled in a variety of different techniques in massage. And today I wanted to kind of just propel our talk with talking about the lymph system and how it really aids in detoxification and everything detoxing in your body, right? And so I'm just gonna let her kind of take away most of this talk and do what she does best in explaining the lymph system and how we can physically get moving by self-massage. So
okay, perfect. Well, like Candace said, I'm Brooke Knight. I've been a massage therapist for 16 years now. I am trained in a variety of different modalities. So everything from prenatal and osteopathic and deep tissue myofascial release to lymphatic and Swedish and relaxation massage. Your lymphatic massage is generally a very light pressure. You actually don't want to go beyond the weight of a nipple. So the weight of your hand is plenty enough weight to get your lymphatic system moving. Anything deeper than that, you really start to run into hindering the lymphatic system, and you get into the deep tissue, which is necessary for a variety of other reasons, but specifically today we're going to be focusing on our lymphatic system. Tell you a brief overview of your lymphatic system really quickly. It runs parallel to your circulatory system, but without a pump. So as your circulatory system has your heart to continue to have blood flowing throughout your entire system, even when you are sleeping or when you are resting or when you are sedentary, your lymphatic system does not have that. Your lymphatic system relies on skeletal muscle, so you moving, to move the lymphatics, to make your lymphatic system work properly and to continuously have motion through there. You have the same basic setup. You have your capillaries, which are just one cell large. One cell at a time will pass through your capillaries, feeds into larger vessels. For your circulatory system, it would be your arterioles or your venules. For your lymphatic system, we just call them venules as well. And it all feeds toward your heart, but it doesn't actually interact with your heart. So you're going to have a couple of different things that you can do, really easy things that you can do to get your lymphatic system moving. To tell you the big purpose of getting your lymphatic system moving, your lymphatic system is responsible for attacking, killing, and destroying all viruses, bacteria, anything that is toxic in your system. Your lymphatic system is the responsible party for getting it out of you, for circumventing any type of attack that virus or bacteria could have on your tissue, any type of muscle, or even in your blood.
yeah.
So we're trying to prevent a toxic buildup through your lymphatic system, which is already in place. So we just want to make sure that that is moving and healthy and continuously flowing so that you get the best possible outcome for your immune system boosting.
Absolutely. And even going further into, like tomorrow I'm going to do like a bigger talk on it, because it's one of those subjects that it's really hard to talk in like 10 minutes or 20, most doctors are like just talk about the blood system. Like this is an entire system in itself, like you said, that runs parallel with the blood system. So it's something that we don't think a lot about, and frankly, it's not talked enough about, and it needs to be, because it's so vital to everyday health. And it, rather than like even doing I'm doing a cleanse, right? But we really need to be detoxing every day to eliminate toxins, and it's something similar that you can do by eating right, first of all, to kind of prevent a lot of the toxic buildup, but by physically being able to do some things. And again, like tomorrow I'll talk about even like dry brushing and ways to detox with baths and all sorts of things. So but yeah, like let's go even into some of the pointers that you had for massage.
Okay. So one of the very easiest things that you can do to get your lymphatic system moving is walking. Just get up and walk. And if you have a sedentary lifestyle or a sedentary job, if you are sitting at a computer desk from 8 a.m. to 5 p.m. everything is stagnant for that.
Yeah.
So set a timer, set like once an hour, just get up and walk. And it doesn't have to be a long walk. It doesn't have to be a strenuous walk. You don't have to run, jump, anything like that. Just walk.
Yeah.
But get up and move different muscles. One of the most common places that we get edema or swelling, especially lymphatic edema, is our feet and our legs. So you may know if you have ever been pregnant, then you notice that your ankles and your legs swell more. If you know somebody with diabetes, they have a higher chance of having that leg, ankle
problems.
right, the circulatory. And so what the issue is that movement is not happening frequently enough. Their body doesn't have enough force to move all of that lymph up, because especially in our feet and our legs, we're working against gravity.
Yeah.
It's just the way it is. So you have to really get going. Short breaks, lots of walking. Another one of the easiest things that you can do, and one of the very best things that you can do, is called a lymphatic push, but it is rebounding.
Yeah, that's exactly what I was going to talk about too.
Yeah, jumping on a mini trampoline is one of the best things, and that's because really what it does is it causes your entire body to contract and expand, and then contract, release with each jump, but it's your deep stabilizer muscles that really start to get moving as well, and that continue. Excuse me.
Yeah, even going into like rebounding, it actually helps with getting more oxygen to your cells, and it's a crazy awesome way because of like how gravity works against it. You're actually pumping more oxygen to your cells, so they're working harder or working better and more efficiency. So like as far as even a workout, it's a more efficient workout and a better workout in the sense of compared to like even running. Like you're getting a better efficient circulatory or workout. So it's awesome for that. But even talk about lymph in the fluid sense, and just to kind of get your picture going, like blood is very like water based, right? It moves very, like when you cut your finger, like it gushes out, or like you can see that very easily. But like lymph is actually lipid, the lymph fluid. It's very lipid based. So if you think about it, like when you pop a pimple, for instance, like what's coming out? It's coming out blood, and you're getting a lot of like the white, like
infection.
Liquid, yeah. So that's all lymph fluid. So it's almost sticky. It's like gel type or gel like, and so to like just even talking about like what Brooke said, like there's not really a pump to push that lymph system. So you have to do things to get it moving, and
you have to be active. You have to move it. One of the easiest things that you can do, and one of the things that I hear very frequently, is my ears. My ears are clogged. My sinuses are inflamed. I've got this congestion in my sinuses.
Yeah.
My throat is sore. You can feel on either side of your throat here and either side of your neck. You have lymph nodes. Most people know when your lymph nodes get inflamed, they get larger, you have an infection. It's what they're supposed to do.
Yeah,
that's okay.
Don't ever let anyone take out your lymph nodes if they swell up, because that was the one thing. Sorry, I just want to like say that, because that's the worst thing you could do for your body, is to actually take out something that your body needs.
And there are situations where like cancer and stuff like that, where like a lympectomy is appropriate. I guess I'm not a doctor, so I can't speak to that. But it, just for giggles, don't. Yeah, a lot of people have the inflammation in the lymph nodes, and it's your body doing what it's supposed to do.
Absolutely.
So one of the easiest. Let me start by saying, right. So you have your clavicle right here, your collarbone, and right below and behind your clavicle, you have your two subclavian arteries, your lymph arteries. And what that does is it drains. This is your main drain into what is your deep lymphatic system, where the blood and the lymph actually come back together, and your good blood cells, all of the good cells, are put back into your blood system, into your circulatory system. So When we're doing manual lymphatic drainage, this is the first place that we start because you want to make sure that these pathways are open. If you think about it like if you have a clog in your hose or something, you want to make sure that the end of the hose is open before you just start pushing more water and things through it, because then you're going to eventually, you run the risk of rupture, you run the risk of just impacting that clog a little bit more and making it so that it won't go anywhere, because just like Candace was saying, it's a stickier fluid. It's not just going to run like water. So if you'll just take your hands gently and place them on either side of your collarbone, and right here, sorry, I've got my necklace. Oh, well, there you go. Right in the middle, it's called your subclavicular notch, your sternoclavicular notch. Right on either side, just rest your hands, and you're just gonna do a pumping motion. And like I said, it's really light. You'll go really slowly, and you're just kind of forcing that pathway open. And then what we're gonna do is from there, you can go as many times as you feel like it's necessary. I usually go 12 to 15 times just to make sure that you've got good flow going. And then, like I said, the weight of a nickel, the weight of your fingertips is fine. You're just gonna go really slowly, and basically you're gonna be stretching your skin. Your lymphatic system runs very superficial, very close to the skin, and it's all in the anterior portion of your body. It's all in the front half of your body until it goes really deep. You have very few lymphatic, the superficial lymphatic vessels on the posterior or the back of your body. So you just go really slowly, and then you move up, but in almost all directions of your body, almost everywhere, you're pumping toward the heart. The only place that you don't pump toward the heart is from your belly button down. You pump towards your inguinal, which is your groin lymph nodes. So you're just gonna follow all the way up, and then you're going in a direction towards your earlobe. So you'll come all the way, and you're just stretching that skin. Once this pathway is open, then you can begin to do the sinus area, and even temporal. You'll pull down and pulling around. And then if you have any type of a sinus issue going on right around your eyes, then you can begin to do that same motion, and it's just skin stretching. You're going really gently, really slowly.
I'm just laughing because we could see ourselves doing it.
We look kind of goofy. We look goofy, but you'll feel a whole lot better. If you wake up and, like me, you have headaches from the pressure change, barometric pressure headaches, if you have any type of sinus and allergy issues, and you've got kids to take care of, you've got work to do, you've got responsibilities that you need to take care of, this is a really quick and effective way that you can make it through your day. Just breaking up all of this and get it flowing. If you have not done lymphatic massage before, and if you lead a sedentary lifestyle and you start with lymphatic massage, or if you are experiencing any of the signs and symptoms of an infection and you do this lymphatic massage, just be warned that there are a couple of things that are pretty common and that can happen. One, your urine is probably going to be a little darker. It might smell a little worse. Two, if you sweat, you're gonna smell yourself. And it's your
everything
body
draining out.
Right. These are natural, wonderful things that are happening. It doesn't feel great, especially, I mean, you're like, oh, that's totally me. But it's good.
That's a good thing.
To, quote Shrek, better out than in. So you want to make sure that you're getting all of this toxicity out, getting these, getting that lymph system moving so that you can experience that higher level of immunity and just feeling great. You feel great.
Absolutely.
So you have a couple of other major areas. Axillary or armpit is another large lymph nodes, large lymph drainage system, and then inguinal or your groin. So the easiest way to do your axillary is really just to raise your arm up, and you're just gonna push down.
Cool.
And so when you're doing this, it's just, like I said, really light pressure, really easy, and then from here you move up, just like we did before.
Cool.
We're doing a really fast version. You can actually do an entire hour, hour and a half lymphatic massage. I'm not gonna bore you with that today, but both sides, and then inguinal, you're doing the same thing. You're pushing up though, pushing up towards your legs, and you're just right into that crease where your hip flexors are, where your hip meets your abdominal area. You're going right into there. So
yeah, very cool.
Yeah.
No, I learned a lot today actually, because I'm learning more and more about the body and like the body parts, and so it's really cool to see how it all like works together for sure, and to learn from someone that knows a lot. That's the whole purpose of it. So awesome. Thank you for sitting down today.
If you're here in Corpus Christi and you have any questions at any point, you can always come into Coastal Wellness and I can talk you through this again. Or if you are looking for a therapist and you want to have a manual lymphatic drainage, is the type of therapist that you're looking for. You want to have somebody that's certified in manual lymphatic drainage.
Awesome. Thank you guys for checking in with us today. Give us a thumbs up and some love to Coastal Wellness and my webpage or Facebook page, CJ's Sweet Life. Thanks.
Bye, guys.
Bye.